Welcome to this video about Hepatitis A, a contagious liver disease. We'll explore what causes it, how it affects your body, and importantly, how to protect yourself. Hepatitis A is caused by the hepatitis A virus, or AV. This virus is primarily spread through the fecal-oral route. This means you can get it by consuming food or water contaminated with the feces of someone who has the virus. Poor hygiene, inadequate sanitation, and close contact with an infected person are common risk factors. Once ingested, the hepatitis A virus travels to the liver. Here it infects liver cells, called hepatocytes. The body's immune system then mounts an attack against these infected cells, causing inflammation. This inflammation disrupts normal liver function, leading to the symptoms we'll discuss later. Hepatitis A is a global disease, but it's more common in areas with poor sanitation and hygiene. Outbreaks can occur in communities, restaurants, or childcare centers where hygiene practices are lacking. While anyone can get hepatitis A, those traveling to high-risk regions are particularly vulnerable. Fortunately, it is vaccine preventable. Symptoms of hepatitis A can vary from mild to severe. Some people, especially children, might not have any symptoms at all. However, common signs include fatigue, nausea, vomiting, abdominal pain, especially in the upper right side, loss of appetite, dark urine, clay-colored stools, jaundice, which is yellowing of the skin and eyes, and fever. These symptoms usually appear a few weeks after infection. Diagnosis of hepatitis A typically involves a blood test. This test looks for specific antibodies that the body produces in response to the hepatitis A virus. A positive test confirms that you have a current or past infection with hepatitis A. Hepatitis A is an acute infection. Chronic forms of the disease do not exist. There's no specific medication to cure hepatitis A. Treatment focuses on managing symptoms and supporting liver function while the body fights off the virus. This typically involves rest, adequate hydration, and avoiding alcohol and other substances that can further damage the liver. Most people recover completely within a few weeks or months. Prevention is key. The most effective way to prevent hepatitis A is through vaccination. The hepatitis A vaccine is safe and highly effective. Good hygiene practices, such as washing your hands thoroughly with soap and water, especially after using the restroom and before preparing food, are also crucial. When traveling to areas with poor sanitation, be sure to drink bottled water and avoid raw or undercooked foods. In most cases, the prognosis for hepatitis A is excellent. The vast majority of people recover completely without any long-term liver damage. While rare, hepatitis A can cause severe liver failure, especially in older adults or those with pre-existing liver conditions. Current research focuses on improving vaccine effectiveness and developing strategies to prevent outbreaks in vulnerable populations.